And what I mean by that is not in the therapy room, but looking at, do they have real life connections? Are they connected to their community? Who is in their life outside of their virtual life, right? That has some, meaning to them and who they connect with. Because I think so much of what we're talking about here is a result of disconnection and people feeling disconnected. So, on top of that, I think there is a point to be made that, that we need to really have, need to have honest discussions about the fact that many clinicians today are just affirming whatever kind of distorted thinking or delusional thinking that their clients have. And again, I think a lot of that is done with the intention of being compassionate and with being an ally. And I don't know where this shift happened, where that became okay to do that. To your point of if somebody says, I feel like using, we don't affirm them and say, okay, I hear you feel like using. Maybe that would be a good choice right now because this is your identity as an addict. We would never do that. That would be insanity. But we're doing that when a young person comes into a therapist's office and says, I identify as a Therian. You know what I mean? I have a saying that I think the child, and I can only speak about the child and adolescent mental health field because that's the world I've been in my entire career. I think it is right on the verge of losing all credibility in many ways. And when I say losing all credibility, I don't mean in academia. I mean with parents because of this craziness.
Can you expand on that?
Well, I think, enough, parents I've heard from have had their kids, go to treatment and either, there's no communication with the parents or, they're an adult under the mental health law, so I can't share anything with you. Parents are not part of treatment. And it's a lot of affirming, identities or as we know, adolescents need to try on different identities. That's part of being a teenager, right? Well, when you affirm every identity a teenager is trying on, whether that's a trans identity, whether that's an autistic identity, whether it's something completely different, and not question anything, that's a problem, because we're not grounding young people in reality. And if you're not grounding young people in reality, then where is their right foundation? Where does that come from?